Mr. Speaker, I rise today to share with you stories from my constituents in Colorado about why we need to pass health care reform. One of my constituents from Boulder, Colorado, Spense wrote to me the other day. He wrote about his experience a few years back when he was visiting friends in France, and his wife had an accident, and acetone entered her eye. This was a very serious emergency situation that, if not dealt with urgently and correctly, could jeopardize her eyesight. Their friends rushed them to a local ophthalmologist near Paris, who immediately took her into their office. He had up-to-the-date high-tech equipment to evaluate her condition of her eye, and his treatment was quick and effective. He also provided continued medication to speed the healing process. All of this, Spense writes, was free, absolutely no cost to a U.S. citizen under the French healthcare program. Spense writes, I hope this personal account will be of use in your efforts. We are most grateful to the French policy and hope that America might find a way to provide similar benefits. I've heard from many other constituents who share these stories of travels in Europe, and likewise, I've heard horror stories of visiting foreigners in our own land and their travails and shock when presented with high health care bills. The truth of the matter is, we have a lot to learn from experiences in other countries. America spends over 15% of our gross national product on health care. The average among the Western European countries and the industrialized world is 8 to 9%. Now, we spend nearly twice as much. Would it perchance be worth it if we were the longest lived and healthiest people on the planet? Perhaps. But we are not. We are in the middle of the pack. Many of these countries, these same countries that spend 8 to 9% of their gross national product on health care, are healthier than us, have longer lifespans than us, according to the World Health Organization. Spence's point is valid. And while this particular set of reforms that we're presenting to the United States Congress is not like the French system, not like the German system, not like the Canadian system, not like the British system, it is a uniquely American system that embraces the power of free enterprise that makes America great, promotes competition among insurance companies through the exchange, provides a public option, provides affordability credits to help middle-income families afford health care. It is a uniquely American solution. It is the right solution, and I encourage my colleagues to support health care reform. Thank you, Mr. Speaker.